Welcome to this HealthClick presentation brought to you by Healthwatch Bristol, North Somerset and South Gloucestershire. In this presentation we will tell you about Healthwatch and encourage you to engage with the NHS digitally using a smartphone, tablet or computer. Healthwatch was first established under the Health and Social Care Act 2012 to understand the needs, experiences and concerns of people who use health and social care services and to speak out on their behalf. Healthwatch Bristol, North Somerset and South Gloucestershire is your local health and social care champion. We are here to listen to what you like about the services and what you think could be improved. No matter how big or small the issue, we want to hear about it. The aim of Healthwatch's digital inclusion project, HealthClick, is to connect people across Bristol, North Somerset and South Gloucestershire to online health services and provide them with digital skills to manage their health needs independently. The key things we'll be discussing are finding trusted health advice online, how to access online GP services, and staying safe online. The NHS website can be accessed at www.nhs.uk, and it is the UK's biggest health website with lots of reliable and up-to-date advice and information. The navigation bar along the top, going from left to right, offers you a Health A to Z, a comprehensive guide of symptoms, conditions and treatments, information and advice to support your general health and well-being. Next, your mental health advice and services, care and support for you or someone you know who needs help with day-to-day living, pregnancy resources, and a summary of NHS services near you. You do not need to register or log in to the NHS website to access this information. The website is monitored and updated regularly, and any groups or charities listed will also have been checked out thoroughly as a source of reliable advice. It's worth visiting the NHS website, even if you've been on it before, to get yourselves familiar with it for when you may need help. Another great site for health advice is patient.info. It is created by a group of GPs and is popular with both patients and healthcare professionals. The navigation bar is similar to the NHS website, so makes it easier for you to find the information you need. We recommend visiting these websites and making yourself familiar with them, even if you don't need them right now. Finding trusted health advice online. www commonly stands for World Wide Web, but it can also be a good acronym to help you determine whether a site is a source of trustworthy health information. If you're on a website and it isn't either the NHS website or patient info, ask yourself who, what, and where. Who is providing you with the information, and what is their purpose? Is it to sell you something, or is it informative? Reliable sites will have contact information or an About Us section. What content is published on the site? Does this site base its information on relevant factual research, and is it up to date? A reliable site will be monitored and updated regularly. Where is the information you're reading coming from? Information might not be relevant if it's come from outside the UK. The web address will give you an idea of the site's country of origin. For instance, a suffix .uk indicates that the site is based in Great Britain. It's always good to be cautious about where you get your health information from. What online services are available? As well as finding general health advice, you can also access GP services online. If you have a non-urgent concern, we recommend using online health services first to try to get support. Each practice differs depending on which services they have turned on, but through apps such as the NHS app, you can book some appointments, request advice, possibly through systems called eConsult or AccuRx, order repeat prescriptions, view some of your medical records, view some test results, manage your first hospital referral appointment, get a COVID pass, manage your organ donation decision, and find reliable health information. What are the benefits of using online GP services? All GP services in England are connected to the NHS app, and most now rely on this. You won't have to wait on the phone for long periods of time to have your call answered. You can submit requests for help at the time of your choosing. All requests for help will be looked at within 2 working days, but most practices will respond on the same day. We will discuss this in more detail shortly. How to set up the NHS app. First, you need to download the NHS app onto your phone or tablet. You can obtain it from the Google Play Store or Apple App Store, depending on the nature of your device. You can also access your account from a web browser on the nhs.uk website. Go to the website and look for My Account in the top right-hand corner of the screen and log in this way. You will need to create your NHS online account in order to use this app. To do this, you will need an email address and a phone number. You will also need to obtain your registration details for online services. You can get this by asking the reception staff at the GP practice. If you are unable to do this, you might consider using photo ID, for instance a passport or driving license. You will then need your smartphone or tablet and a good Wi-Fi connection. Our how-to guide, a link to which is at the end of this presentation, will take you through these steps in more detail. Once you are fully connected, this is what the home page of the NHS app or website looks like. On the left is what it looks like on a smartphone or tablet, and on the right, a laptop. The navigation bar will help you find your way to the different online services listed on the previous slide. Advice. The advice section is where you can search for conditions and treatments, use the 111 online service, and access eConsult or AccuRx under the Ask Your GP for Advice section. This allows you to send a message to your practice. The steps on how to submit a request are detailed in the how-to guide. Appointments. In the Appointments section, you can view and manage appointments at your surgery, if your surgery has this service turned on. You can also access additional GP services, such as requesting sick notes or a GP letter. You can manage your first hospital referral appointment and book or manage a COVID vaccination as well. Prescriptions. This is where you can order repeat prescriptions, change your nominated pharmacy, and view the status of any prescription orders. Again, the how-to guide goes through how to access each of these options. Your Health. Finally, the Your Health section allows you to get your COVID pass, check your COVID vaccine record, view your GP health records, including things like medications, immunisations, test results, and consultation notes. And you can also manage your organ donation decision and decide how your data is used. Each of these sections may differ depending on which GP practice you are registered with and which services have been turned on. Staying safe online. In order to stay safe online, we recommend creating a strong password. A strong password should include both uppercase and lowercase texts, numbers and symbols. If you think that someone has seen your records without your permission, for instance, if you are using a shared computer, then change your password straight away. Be careful who you share your records with. Consider whether it is in your best interests to share your health information and what the person you are sharing it with might do with that information now or in the future. Think carefully about what sensitive information may be in your records and how you would feel if it was shared more widely. If you're in any doubt, don't share. If someone is trying to force you to share your records with them, tell your health and social care professional and they can support you. Be cautious about emails or texts asking for financial details. The NHS app and website are both completely free and will never ask you for financial details. If you receive an email or a text asking for any sort of payment relating to health services, it is probably a scam, so don't respond or click on the link. Just delete the message or block the message or both. Be suspicious of any emails asking you to check, renew or share your login details or passwords. An official source will never ask you to share these details. Here are some links to our websites and to our how-to guide. Thank you for watching this presentation from Healthwatch Bristol, North Somerset and South Gloucestershire, and don't forget to get in contact with your local Healthwatch if you have any recent experiences that you would like to share.